Hi, I'm Danielle, perinatal and pediatric nurse educator at West Coast General Hospital. In this video, we will be reviewing setup and usage of the Hamilton CPAP vent in LDRP. All of the equipment for the Hamilton is located in the nursery cupboard. We will begin today's video by going through how to set up the neonatal circuit for nasal CPAP mode. Before you begin setup, ensure you have received the two pieces of equipment cleaned and sterilized from MDRD. The expiratory valve with attached membrane and the temperature probe wire. Prior to setup, ensure the ventilator is plugged in and connected to the wall and oxygen source. The Hamilton will be left in nasal CPAP mode when not in use. Now we will start with the instructions to set up the Hamilton for nasal CPAP mode. Step 1. Open the neonatal circuit bag. Remove the blue plug on the top of the humidifier chamber and discard it. Slide humidifier chamber into the humidifier. Reminder to keep all of the other parts in the bag. If babe deteriorates and needs to be intubated, you will need the additional pieces. Insert expiratory valve into the side of the Hamilton ventilator. Once you put it in, you move to your right and you'll feel a click. Step 2. Attach short blue tube to inspiratory valve on Hamilton ventilator and the other end to top of humidification chamber. It doesn't matter which port on the humidification chamber it gets inserted onto. Step 3. Attach long blue inspiratory tube to the top of humidifier pot. Remove short portion at end of expiratory blue tubing and discard, as this may lead to condensation problems. Due to COVID safety precautions, add intersurgical air filter to expiratory valve. Step 5. Attach white expiratory tube to expiratory valve located on the side of the Hamilton ventilator. Remove Y connector from the end of the white expiratory tubing and place back in the neonatal circuit bag. This piece is only to be used in ventilator mode. Cover end of white expiratory valve small side port, as it is not to be accessed. Humidifier and temperature wire setup. There are two main wires attached to the humidifier pot, the yellow-ended one and a blue-ended one. Insert blue end of temperature probe, which will come sterilized from MDRD, into matching blue port on side of humidifier. Attach the 3-prong end from the yellow humidifier wire to the inspiratory tube connected on top of humidifier pot. Attach 2-prong yellow humidifier wire to top of white expiratory tube. Step 4. Attach temperature probe at the end of the blue inspiratory wire to the lowest port on the blue inspiratory tube closest to the patient. Step 5. Attach the 2-prong probe from the blue humidifier wire into the humidifier port. Pressure gauge setup. Step 1. Remove pressure gauge tubing found in the neonatal circuit bag. Remove the plastic piece from the end of the pressure tubing and discard. Attach to the side of the ventilator where the pressure gauge tubing adapter is. Attach white expiratory tubing and blue inspiratory tubing to the Flexi Trunk nasal CPAP generator. Hamilton setup. Step 1. Turn on Hamilton machine. Step 2. Machine will auto default to nasal CPAP mode. PEEP will auto set to 5 of water, and oxygen will auto set to 21% or room air. Confirm settings are accurate. Step 3. Enter weight of the newborn. This is not necessary for nasal CPAP, but it is good practice to get into. Step 3. Perform your pre-op check. Prior to starting nasal CPAP ventilation, touch the pre-op check button in the standby window. This should also be checked weekly by nursing and RT to make sure the setup is ready for immediate use. Pre-op check. Tightness test. This to ensure the circuit is set up correctly. There are 2 pre-op checks that have to be done before usage. Step 1, tightness test. This to ensure the circuit is set up correctly. Touch the tightness button to perform the tightness test. Follow the prompts. Occlude end of the breathing circuit with a gloved hand when it says disconnect patient. Hold against your hand for direction maneuver in process. Release when it says connect. Once complete, you should see a green check. If you get a green check, proceed to circuit check. Step 2, circuit check. Stand by and wait for another green check. If you get a red X, the system is incorrectly set up. Do not start any therapy with the patient. See troubleshooting tips attached. Note, you do not have to do the O2 cell calibration test. The machine will prompt you to do it periodically, or it will do it on its own. Please ignore for setup. Use the sizing guide to choose suitable prongs or mask. The mask should not touch the edge of the nose, septum, or the eyes. Measure the infant's head circumference in centimeters. Choose the correct size bonnet. The bonnet should be snug fitting. Slip the bonnet onto the infant's head, completely covering the ears and with the back edge of the bonnet at the base of the neck. The front edge of the bonnet should be just above or on the eyebrows. Connect the mask to the nasal tubing, ensuring that it is fully inserted. Connect the patient by placing mask around nose. The mask should sit comfortably around the patient's nose. It must not occlude the nostrils or touch the septum and should not be over the lip or over the eyes. Hook the clips from the side straps of the bonnet to the glider. Pull both straps at the same time for central positioning. And that completes the nasal CPAP setup mode. The outside of the Hamilton ventilator can all be wiped down with Virex wipes as well.